Medical Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Immunotherapy plus chemotherapy combination for advanced lung cancer improves and prolongs life, shows study. A recent clinical trial showed that the drug combination of cemiplimab plus platinum chemotherapy can prolong survival in patients with advanced lung cancer when compared with placebo plus platinum chemotherapy. Now, an analysis published by Wiley Online in Cancer Journal indicates that cemiplimab plus platinum chemotherapy also affects quality of life compared to chemotherapy alone. The multinational phase 3 EMPOWER Lung 3 trial had shown that the addition of cemiplimab to platinum-based chemotherapy was associated with improved survival in patients with advanced stage non-small cell lung cancer compared to chemotherapy alone. Because quality of life is also an important parameter for treatment benefit, investigators examined how cemiplimab plus platinum affected symptoms in comparison to chemotherapy alone for patients enrolled into this trial using the EORTC QLQ-C30 and QLQ-LC13 questionnaires. Study links pediatric IBD risk to antibiotics, Western diet, and higher family income. Children and adolescents face greater risk of IBD or inflammatory bowel disease when exposed to antibiotics or a Western diet at early ages, or when their family has higher socioeconomic status, according to a study being presented at the Digestive Disease Week 2023. A unique concern about pediatric IBD is the impact that the inflammation has on a child's growth and the progression of puberty, so parents should be aware of this condition and the modifiable factors that influence it. Domestic abuse exposure and increased levels of asthma and other atopic diseases linked, shows study. Women who have suffered domestic abuse may have a higher risk of developing atopic diseases including asthma, new research has found. Published recently in the Journal of Allergy and Clinical Immunology in Practice, the research led by the University of Birmingham found that in analysis of patient records, there were a significantly larger percentage of women who had atopic diseases and had a history of being exposed to domestic abuse and violence compared to those who hadn't. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.